So I just want to start by saying that I'm really, really happy to have joined the steering group here at the Nourishing Futures Network as of the end of 2023. It was such a night and a surprise when Nicola and Fiona, sort of the original leads of the network, reached out to me. Because food security during critical phases in the life course is absolutely my passion, and it's been such a pleasure getting to work with these wonderful, similarly passionate women at the Nourishing Futures Network for the last half year or so, and to be involved in kicking this network off today. I really look forward to getting to know more of you on this call or this first webinar. As you just heard, the title of my talk today is Pre- and Perinatal Food Insecurity in a Scandinavian welfare state. And the welfare state is Denmark, which you'll hear more about in a few minutes. I think I have this slide here. I think I'm going to skip through because I think you actually heard quite a lot, particularly from Dr. Lin Yi just now, about some of these sort of like bigger picture social units of health that play into food insecurity during pregnancies, and we just and some of the social or some of the health outcomes that are associated with those. So I'm just going to go straight the community case study side of things, and I'm going to. So my original plan was to talk almost exclusively about my work in Denmark, but I've now decided that I'm going to bring you along on a little ride through what brought me to this line of inquiry in the first place, which was through another community case study, which Paige also mentioned when she was introducing me. And both of these cases are somewhat about naivety on my part. So my current work in Denmark came more or less directly out of a project in my home country of Canada called the Mothers to Babies in Hamilton, Ontario study. And it was directed by my former postdoc mentor, Professor Deborah Sloboda at McMaster University. And I think I saw that Deb was on the call. Hi, Deb. And co-led myself and two other former mentors, Associate Professor Tina Moffat, also at McMaster University in Canada, and Professor Mary Barker at the MRC Life Course Epidemiology Unit at Southampton in the UK. And Mothers to Babies actually asked a number of different big questions using sort of a relatively little community-focused lens. But I'm just going to note two of them here, which I think are relevant to this story. Kai, if you don't mind moving the animations forward, that would be great. Thanks. So first we asked what are some of the sociodemographic and structural factors that are associated with variation in pregnancy nutrition and pregnancy health in the city of Hamilton, Ontario, where the project and McMaster University are located. We're located. And secondly, what can researchers and local institutions do to promote health and healthy nutrition during pregnancy? I am focusing on Hamilton, Ontario. And this was back in 2017 and 2018 mainly. We tried to answer these questions by a series of focus group discussions, 10 focus group discussions, some of which were with pregnant people and new moms. And some with relevant health and social care providers like midwives, public health nurses, and early childhood educators. In this in this image here, you can see me running a group of early childhood educators who work directly with parents of very young children and often also with pregnant people. In addition to focus groups, we also ran a prospective respondent-driven community survey of 350 pregnant people. And there's a picture of the survey also on this slide. If you could move ahead, that would be great. Okay, here comes a little bit of naivety. Before starting to talk to people about their experiences, I genuinely thought that in 21st century Canada, supposedly one of the world's most gender equitable countries and one of the ones least badly hit by the 2008 financial crisis, and with a new child benefit that was supposedly lifting loads of families with children out of poverty, that extreme financial stress wouldn't be the main factor driving poor health and nutrition during pregnancy, aside from maybe in rural or indigenous communities. But in every single focus group we ran in Hamilton, both the ones with parents and the ones with health and social care providers, basically the first thing we heard when we asked what challenges make it hard to eat healthy and support people to eat healthily during pregnancy, we heard quotes like these. New animation, please. Yeah. So from one new mom, we heard, 90% of your income feels like it's going to your homes. So that really takes away from your ability to provide healthy food for your family. I wish I had poems of some of these interviews and focus groups, like we heard from Danielle earlier, because that's such a beautiful way of building some of these narratives. But I'm using. But I think these quotes are also quite illustrative. From Public Health University, and this was by no means a one-off. We heard many of the pregnant people we work with, they just don't have the money to buy food. We're talking about serious food insecurity here. So I really didn't expect that. And I found myself Googling this is sort of 2018-ish. What exactly is food insecurity in a wealthy country in an urban setting? Can you go actually kind of, sorry. What is it in this food insecurity in a wealthy country in an urban setting? How is it measured? What are its health effects, especially during pregnancy? And I found literature on a lot of those sort of big picture epidemiological patterns that we already heard about, particularly from Dr. Yi a few minutes ago. And looking into that literature prompted me to wonder what, if anything, our survey data could tell me about food insecurity beyond the already anecdotes and arguments we heard during the focus groups. And now we can go ahead to the next slide, please. Yeah, thanks. So since our survey wasn't originally about food insecurity, we didn't have any validated scale items. We certainly didn't have the hunger vital sign item that we just heard about. But we did have 5 Likert scale questions that had to do with financial and material hardship in relation to food and nutrition. And I used those to make a quick and dirty food insecurity scale. And there were at least 59 out of those 350 survey respondents who looked like they were probably living with moderate to severe food insecurity. If you think back to that image that Danielle showed early on, so we're not talking necessarily about hunger, but sort of the middle of that graph that she showed, where we were talking about worrying about food, money for food running out, and sometimes maybe skipping meals. Certainly making trade-offs in terms of food quality. And this is a way under powered and post hoc analysis and blah blah blah. It's certainly not publishable, but I think it's worth showing you here that those respondents to our survey who reported or who I think we can class as moderate to severely food insecure, appear to have elevated odds of reporting being diagnosed with 1 or more pregnancy complications, especially gestational diabetes, and maybe also especially with respect to disordered blood pressure. Next slide, please. This is basically the same point again from the mothers to babies data and in Hamilton, Ontario, Canada. And this is just shown another way with a forest plot. So those who appeared food insecure had 1.2 times increased odds of reporting a diagnosed pregnancy complication after adjusting for gestation weight, maternal age, and pre-pregnancy overall health. Next slide, please. So now we have these data from the Mothers to Baby Canadian case showing that food insecurity exists. It's a huge problem, maybe the single biggest problem shaping pregnancy nutrition and health in Hamilton, at least among the parts of the pregnant population living with lower incomes. And this is not a problem that can be solved with better regulating for how we, for example, tax sugar-sweetened beverages, which was one of maybe my priority expectations about what we were going to do in this context. It was certainly not a problem that could be solved with, for example, like healthy pregnancy cooking classes. And what can we actually do about it? We figured that our focus data might also offer an answer to this "what do we do about it" question. In particular, there were multiple public health nurses who said, and I'm paraphrasing here, but like they said, like, it's the government, like the government just needs to give people more money. And put another way, what we need in Hamilton, Ontario is a more robust welfare state. Next slide, please. Answer felt right to me, but I'm a researcher, a social scientist, and I figured I'd actually look at the evidence when asking the question, can a robust welfare state prevent food insecurity during pregnancy and perinatally? Next slide. So I was lucky enough to receive 3 years of support from the Aarhus Institute of Advanced Studies when I applied to go look at the pregnancy and food security landscape looks like in Denmark, which is widely regarded as one of the countries in the world with the least socioeconomic inequity, with high levels of social trust, and crucially, a relatively generous welfare state. So I and a number of students who will acknowledge properly at the end of the presentation, we kicked off the Supporting Pregnancy, Food and Nutrition Security, or SPOONS, in Denmark in December 2021, and we wrapped up data collection in December of 2023. And basically, animation, SPOONS asked, to what extent does Denmark's welfare state mitigate exposures of pregnant people, new parents, and young children to food insecurity? And next question, if so, do these mitigations hold in the country's most marginalized neighborhoods? Next slide. Like with mothers to babies, we used mixed methods at SPOONS. We started with focus groups and interviews with pregnant people, mothers, and social and healthcare providers who support them. And these focus groups and interviews informed the development of a respondent-driven survey of about 600 expecting and new parents, which I'll come back on the next slide. And the qualitative data were collected exclusively from people living and working in so-called parallel societies neighborhoods, which are represented in these maps. And I wish I had time to explain what these are, but that's a whole separate lecture, which would take at least 15, 20 minutes to explain and unpack. All you need to really know for right now is that there are 11 parallel societies neighborhoods around Denmark, and that these are politically and socioeconomically marginalized in various ways, and that we worked in 2 of these, one and one called Bispehaven, both outside of the second largest city in Denmark, which is Aarhus, and it's also where I live and work now. Anyway, there are a couple of important themes that emerged, which I think are illustrated by these quotes that Kaya is just nicely putting up for us. And first, despite the vast welfare state, at least in these 2 parallel societies neighborhoods, there definitely are pregnant people and new parents living with moderate or even severe household food insecurity. We heard plenty of stories, both direct and secondhand, that sounded like this. I was just there after paying rent, after feeding my older kids. By the end of the month, I just didn't have enough money to feed myself properly when I was pregnant with my 4th. So that's theme 1. Resources for mothers were limited, and they had to make some tough choices. These didn't always come to the fore right away, though. We had to ask directly, which was like noticeably different from how it looked in Canada. Theme 2, if we can have the next animation, is about how in Denmark, your perspective and your position in society, your positionality, really affects your awareness or perception of food insecurity, I think. The health and social care providers working in Denmark said a lot of things like this. It, i.e. food insecurity, isn't really a big deal, and it's not a money problem. It's about giving parents guidance and knowledge. This is the one I wanted, yeah. It's about giving them guidance and knowledge. So my situation is that despite its existence food insecurity's existence among parents, food insecurity as a financial issue really isn't part of the training or consciousness of many clinicians in Denmark. Next slide, please. Now, when we look at our 2023 SPOONS survey data, which was open to any pregnant people, new birthing parents, and their partners living in Denmark, and I'm just going to show you the bit of data from 532 birthing parents. And I'll note it's not representative by any stretch. We over-advertised in neighborhoods and on social media channels where respondents were likely to be socioeconomically challenged, as well as within our own networks where respondents were likely to be extremely well-educated and relatively well-off. So we can't go widely extrapolating based on this sample, but nevertheless, there are a few things worth highlighting. Next animation. So the good news is basically our initial goals of getting policy inspiration from Denmark to take back to Canada, by likely overrepresentation of socioeconomically challenged folks, about 62 or about the % of SPOONS survey respondents appeared fully food secure, no worries whatsoever about their finances and making healthy food choices. And another 23% were maybe barely marginally food and be a little bit worried, a little tiny bit financially stressed. Next animation, but there were also 79 or 15% of these mothers or expecting pregnant people who were dealing with moderate to severe food insecurity, who answered yes to a number of questions on the 6-item food security module, suggesting some real stresses and sacrifices in their diets and nutritional well-being. Next slide. The other thing I want to show you is that in Denmark, as elsewhere, that this is a money problem, not a knowledge or bandwidth problem per se. So on the x-axis here is where we ask people to rate their household financial well-being on a from 1 to 10, where 1 is no economic stress, can afford vacations and relaxation, et cetera, without even thinking about it. And 10 is high economic stress, unable to make basic material needs meet. And this scale tracks very well with the income, education, and immigration history data we also collected. And basically, you can see here that food insecurity scale score on the y-axis is associated with economic stress on the x-axis. And I note quickly that the color codes, which are based on whether or not respondents lived in these so-called parallel societies neighborhoods, that the slope is steeper for those that do live in such neighborhoods. Those are the ones in teal. So this survey data suggests that something may be at least a tiny bit rotten in the state of Denmark, particularly in these parallel society neighborhoods. And this slide, I actually decided that I didn't want to present because I don't think it really plays into the narrative that I think was, or the argument I really want to make here. Instead, I want you to try to imagine, I'm just going to talk about like comparing what we found in mothers to babies, which I think is one of the sort of, it's really hard to find an appropriate comparison for the spoons data because of the nature of this like sort of weird shaped community sample with a lot of really most stressed people and then also the most affluent people. But the mothers to babies data are actually quite similar. And I think when we compare those two samples, the prevalence of household food insecurity among respondents is significantly lower. It's definitely not statistically significantly, but just conceptually, biologically lower in the Danish case compared to Canadian case, and you get an even bigger difference when you zoom in and look at the people who were on receiving their supports from the welfare state. So for those spoons respondents who reported that their main sources of income were from state welfare benefits of one sort or another, about just under 30% of those respondents were marginally to moderate or moderately to severely food insecure, whereas when you zoom in on that subset of the sample in the Canadian case, close to 60% had that were living with moderate to severe food insecurity during pregnancy. So that to me really suggests that the Canadian welfare state is doing a less good job of making sure people are not dealing with poverty and food insecurity, and the Danish case and the Danish state is doing a better job. So to sum up, food insecurity affects it affects at least some pregnancies in Denmark. Even if the sample isn't representative, just the raw numbers from the survey and then the stories from the focus group suggest that there's an unacknowledged problem here, particularly in the parallel society neighborhoods. But we should definitely not underplay the evidence that the Danish income redistribution model is clearly helpful in mitigating food security during pregnancy, like we expected it to be. And like I said, about 30% of respondents on state-only incomes were food insecure compared to almost 60% of Canadian respondents on state-only food incomes. So it's easier to make ends meet in the Danish welfare system. Next. Nevertheless, there are shortcomings and blind spots in the Danish system, which means that it's unlikely that importing a Danish welfare redistribution model whole cloth into other high-income countries would be a silver bullet for preventing food insecurity during pregnancy in those countries. And among those shortcomings is the third point on the screen here, which is really that Danish health and social care providers are largely unaware of the problem of food insecurity during pregnancy and perinatally, which means that they have trouble developing or offering needed supports. You can't really solve a problem that you don't recognize as existing. And finally, I would say there's a need not only to take insights from Denmark to elsewhere, but also a real need to disseminate findings direct to care providers and maybe especially to policymakers here in Denmark, which is one of the main things I plan to do with the next few years of my working life. And with that, I think I'll wrap up because I haven't been keeping time, but I suspect it's been about 15 minutes or maybe a little longer. And I just want to thank the Aarhus Institute for Advanced Studies for support, and especially Khali Ibrahim, Hamda Wabiri, and Hamda Igal, the students, the master's students who helped with, who did really a lot of the data collection with me and or under my mentorship.